Okay.
And when it was approved.
All right, we are live.
Yes.
We are. Tell everyone your name.
My name's Jonna Meeks.
And what's your profession?
I am a registered nurse, and I work in labor and delivery.
And how long have you been doing that?
17, 18 years now.
So we were discussing earlier that we at Children's Self Defence, for example, have seen a huge increase in people reporting miscarriage, stillbirth. What have you seen in your work?
Definitely an increase in patients coming in with demises early, in the pregnancy, as well as up to full term, that we have to deliver their dead babies.
Which is a terrible thing for someone to go through.
And although it is something that historically happens, and we really don't know the reasons, I feel like from my experience over the last 17, 18 years, it has definitely, it's almost like double, triple fold. I've never seen so many miscarriages and intrauterine demises before.
And do you know if these women whose babies have died, have they taken the shot, or we just don't know?
I know the majority that, I wish I could have all the stats of that, but the majority of them, if I am their nurse, I can look at their charts. If I'm not their nurse, I cannot. So the ones that I have looked at have been vaccinated at some point. Whether it was before their pregnancy or during the pregnancy, but there is a vaccination.
Yeah, because we were talking about someone potentially that has had a COVID shot before, then gets pregnant, has one at the beginning of pregnancy, and then a booster. Yeah. It's a lot. And plus the other vaccines that they're giving to pregnant women.
Yeah.
Because they tend to take them all.
And initially, maybe not initially, but in the middle of them, pushing the vaccine to pregnant women, they were learning that it wasn't good to give women prior to 20 weeks. So that wasn't being pushed. But once they were over 20 weeks or prior to pregnancy, they were definitely, you could see in the notes that it was, encourage the vaccine.
And what are you hearing within your hospital or within your colleagues about the babies that are born to vaccinated mothers? Are you seeing anything different with the placentas, or is there anything you're hearing about?
I'm not 100% sure as far as like the placentas, but I'm a conspiracy. It's all a conspiracy. I'm crazy because I've taken the data and taken what I know of science and putting the two together and makes sense. But nobody else is kind of thinking that way. And if they are, they're not expressing it. If I have a belief and I've got data to back me up on, then I'm not going to buckle. Now, if I don't have the data and you're presenting me with, these things, then I will look for the data, which is why I did not get vaccinated, because from the beginning, it was almost like having to go to the, dark web to find this information because they were censoring everything. But the information was out there about the vaccination and how, in 2 years from 2020, we were going to see deaths, miscarriages, heart problems. What do you know? 3 years later, every bit of that has come true.
What about the placenta, blood clots, or anything like that?
So there's been a few moms that have had to have a special team involved in their surgeries for having C-sections because of the moms having extreme blood clots. They were worried for pulmonary embolisms. We did have one mom who died on the table but was brought back, and she did fine, but she was full of clots. And so there's been a few of those that I know of. But placenta-wise, I'm sorry, I don't have.
17 years ago, whenever it is you started out on this journey, did you hear of people with blood clots?
No. It was just not. And I worked in, a few hospitals over the years. And I've never seen so many as I do now of the babies, aborting early or being, doing fine up until a few months, and then they die in utero.
Do you think any of these mothers are having these 2-3 shots and then having these stillbirth babies? Do you think that they're putting 2 and 2 together?
I think some of them are, and they're usually the ones that are openly, we'll discuss it, and they'll say, I had to get it because some more of them were in school, or to keep their jobs, and so they got the vaccines, and they obviously regret it, but yeah, it's really sad that we were forced into this, and so just to be able to go to school or keep their jobs.
Did they make you have one?
They tried to, but again, I was not going to waver. I had gotten COVID when it first came out, and I just had, mild case of like sinus infection is what it felt like. And so when I returned to work, they wanted us to come to work. If nurses got COVID, they need to be back to work in 10 days regardless. Where the rest of the country was able to take months off, or at least 2 weeks off. And so we were back to work as soon as we could go back. And then I was told, well, you have to get vaccinated, but because you just had COVID, you got to wait 3 months. And so I said, well, I'm fairly sure that my immune system has built an immunity and I'm not getting the vaccine. And so there was a few of us that were, these crazy nurses that had these, ideas of, vaccines. I'm not an anti-vaxxer. My children have all their vaccinations. I think there's way too many today, but so it was 11 months later that they were accepting the religious exemptions, because there was too many nurses that were either quitting because they didn't want to get the vaccination and didn't want to lose their jobs, so they went on to a different field, or they got the vaccine and were having issues. So anyway, I waited until the last minute to either get fired or them accept the exemption. And there were too many nurses that were either quitting and getting sick, so they didn't have very many nurses. We had a very big nursing shortage because of this. It's not because the hospitals were full of sick patients. It's because they didn't have enough staff because of the mandates. And so, I was willing to lose my job over it.
Thank you for talking to us, especially about the babies. It's really sad. If you look at everything that's going on right now, elderly dropping dead, the babies, it's like you have to say to yourself, this is depopulation. You have to.
Right.
Because I don't understand how else it continues. I don't know.
Yeah.
But killing the unborn.
Yeah.
It's criminal.
Yep. And there's, another conspiracy against, genocide and all that, but.
Yeah. You can't ignore it. When you listen to the stories like we do,
mm-hmm.
day in and day out, it's the same story over and over again. All right, we still do have more stories. Stand by, everybody, and thank you so much.